We are learning more tonight about the possibility that President Trump will push for a revival of efforts to repeal and replace Obamacare. Chief White House correspondent John Roberts has the latest information. Good evening, John.
Shannon, good evening to you. Would President Trump like to resurrect his health care bill and see it to a successful conclusion? No question. Is it possible? That's another question altogether.
Thank you very much.
In his opening bid to restart talks on health care reform, President Trump went for the tongue-in-cheek approach for the bipartisan group of senators.
I know that we're all going to make a deal on health care. That's such an easy one. So I have no doubt that that's going to happen very quickly.
Finding common ground will be neither easy nor quick. The president gave everything he could to the House Freedom Caucus members on the first go-around, and they still walked. Many Republicans are said to be frustrated with the Freedom Caucus over what happened last week, saying, quote, they botched this. As a finger in the eye to the Freedom Caucus, the White House is holding out a carrot to Democrats, inviting them to get on board a new effort.
I think it's going to happen, because we've all been promising, Democrat, Republican, we've all been promising that to the American people.
In a letter to the president, Democrats said they'd be happy to work with him on health care if, quote, you abandon your efforts to repeal the Affordable Care Act and you rescind your ACA executive order signed on January 20th, neither of which would fly with Republicans. Sources on Capitol Hill caution not to make too much of the new effort. The House Freedom Caucus, Republican Study Group, and more moderate Tuesday Group have been meeting to see if they can work something out. But sources say so far they've come up with nothing that resembles a way forward. A White House source says the president is sitting back, letting the Freedom Caucus and Tuesday Group work to see if they can find points of agreement before stepping back in.
Despite the setback that we got last Friday, I think there is a renewed willingness from a lot of members who made commitments to the American people and to their voters that they want to see this done.
President Trump tackled another thorny health care issue today, hosting a listening session on opioid abuse.
Drug abuse has become a crippling problem throughout the United States.
The president made opioid abuse a major part of his campaign, particularly in New Hampshire, where more than 400 people died from opioids in 2016. President Trump today signed an executive order creating a task force to attack the problem, to be chaired by New Jersey Governor Chris Christie, who had a close friend die from prescription drug addiction.
What this task force hopes to do is to look at the issue of prevention, obviously interdiction of drugs before they come to our country, but also, and very importantly, the issue of treatment. Addiction is a disease, and we need to treat it that way, and we need to give the people the help that they need to renew their lives and help become productive members of society and our families.
This new commission is just a starting point to assess the problem, measure the federal response, and then make recommendations to President Trump. Actually coming up with a new plan to attack the problem will be sometime down the road. Shannon?
All right, John, and also some news tonight on Ivanka Trump changing her status with regard to the White House. What can you tell us?
It really is. It's a new designation for her. Originally, she was coming to the White House to act as an advisor to her father, to get involved in some programs, but not be an official employee of the White House. But that raised a number of questions about ethics concerns and complying with federal guidelines. So tonight, Ivanka Trump released a statement saying the following, quote, I have heard the concerns some have had with my advising the president in my personal capacity while voluntarily complying with all ethics rules, and I will instead serve as an unpaid employee in the White House, subject to all of the same rules as all other federal employees. Throughout this process, I've been working closely and in good faith with the White House counsel and my personal counsel to address the unprecedented nature of my role. The White House says it's actually beneficial for her because she'll be able to contribute much more broadly than she would have had she stayed not being an employee. Shannon?
All right, John Roberts live at the White House. Thank you.